Okay, let's discuss about postpartum hemorrhage. The definition of postpartum hemorrhage, there's primary PPH, whereby there's a blood loss 500 cc within 24 hours post-delivery. Secondary PPH is when the blood loss within day 1 until 6 weeks post-delivery. The difference between antepartum hemorrhage and postpartum is that APH is before delivery, PPH is after. If it is non-viable, less than 24 weeks, it's called miscarriage. Example of APH, abruptio, placenta previa, vasa previa. Okay. The risk factors for PPH divided into 40. Tone, tissue, trauma, thrombin. Let's go to tone. Tone risk factor usually due to uterine atony can be caused by over-distender of uterus due to multiple pregnancy, polyhydramnion, or microsomic baby. It can also be caused by myometrium fatigue due to hyperstimulation, prolonged labor in the first stage, or pitocin augmentation. Okay, tissue. The next risk factor T, tissue. Retained tissue in the uterus can cause PPH. Third, T is trauma, genital tract trauma. Perineal tear divided into first degree, secondary, third degree tear. First degree tear, mucosal and skin. Second degree tear involve muscular tear, which is the episiotomy, and third degree tear divided into 3A, 3B, and 3C. 3A whereby involve less than 50% external sphincter. 3B involve more than 50% external sphincter, whereas the internal sphincter is intact. 3C involve tear of the internal sphincter. The complication of postpartum hemorrhage include anemia, shock, DIVC, acute kidney injury, maternal death, hysterectomy, Sheehan syndrome. Sheehan syndrome is ischemic injury at the pituitary gland, and it will result in amenorrhea because it won't be able to produce FSH and LH. Let me discuss on why DIVC happen. This is really important. When bleeding occurs, there's too much bleeding, there will be overcompensated of a coagulation profile, and thus resulting in the microthromby of the small vessels. And the small vessels will rupture and causing continuous bleeding. So in the patient, there will be high in PT, APTT, INR, but can't stop the bleeding. So the management will do the DIVC regime transfusion. Management of PPH. Okay, we can divide it into mechanical, medication, and surgical. The mechanical management by manual uterine compression, whereby ambil satu tangan, tumbuk dekat dalam anterior fornix untuk compress the uterine artery. Number 2, uterine massage. One hand massage dekat fundus to kecutkan the rahim. And the medication management, we can give pitocin or syntocinon or synthometrin or hemabed. Hemabed is contraindicated in bronchial asthma. Surgical management by using vacuum balloon to compress the uterine artery, inflate the balloon inside the uterus.